really the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hey everybody, we're back after a very, very, very long break. This is Dr. Natalie Brackeen.
Hey, this is Dr. Dame.
And this is Vet Tales. Summer's been crazy for us. For one, I don't know if you people listening know this, but the summer months in veterinary medicine, without exception, are the busiest months all year for us. There's a lot of things. People always ask me why. I think, some of it's just like, for starters, people are home with their pets more. Secondly, there are a lot more viable parasite and virus and bacteria organisms in the environment during the summer months. Also, pets get out and do more crazy things like, leave the yard in search of a soulmate across the fence or something, get hit by cars, get, attacked by raccoons. I don't know, what they're doing really. But we do stay very, very busy in the summer, and we had a doctor on maternity leave. So it has been a lot of running. So that's why you haven't heard from us in a while.
Mm-hmm.
You want to tell them about today's topic, though?
We are talking about FIV and FeLV, which is feline leukemia virus and feline immunodeficiency virus.
I don't know how we missed this so long.
I do not know either.
I went back through the list of podcasts several times going but wait. Are you sure?
Done it? Yeah. Because it's very, very important part of our wellnesses.
Yeah.
And I think most cat owners are used to us talking about testing for it now, which is great. But it is something that is very important for just preventative care for pets.
I'm going to suspect we probably touched on it in a vaccine podcast, but never have we really broke it down. And it actually came up because one of my technicians had a family member whose cat was FIV positive, and she was like, hey, I was going to send them to the podcast episode on that. And I went. So here we are. Okay. I don't know. Which one do you want to talk about first?
Probably FIV.
Yeah, I was thinking the same thing. I wonder if it's for the same reason.
I'm worried this hit the wrong thing.
Well, I was thinking we should talk about it first because it feels a little less daunting.
Oh, yes. Much less daunting.
Okay, go.
Yes. So FIV, feline immunodeficiency virus, is an immunodeficiency virus, fun kind of thing. But essentially, it is actually closely related to HIV, and that usually helps people kind of get their mind around it pretty quickly and be like, okay, it's going to lower the immune system. The interesting thing about FIV is the transmission is typically through fighting. And so biting and scratching are going to be big ways of transmission for these pets. So any cat, and I should just blanket term this, any kitten that comes into our clinic at 8 weeks is getting tested for FIV and FeLV.
Mm-hmm.
But any cat who is an outdoor cat is going to be tested yearly for FIV and FeLV.
Mm-hmm.
And the reason being is we want to know if they ever come up positive so that we can adjust care and recommendations from there.
Yeah.
If a kitten were to come in and test positive for this disease, because the diagnosis is made through something called a SNAP test.
Just like an in-house, blood test.
Little blood test. And you put the blood in, you snap it. FeLV is looking for antigens to that disease. FIV testing is looking for antibodies. And so if we have a kitten come in for FIV and test positive at 8 weeks, we will retest that kitten later and hope that the antibodies were just from its mom.
Yeah, maternal antibodies.
So,
which is also why we don't vaccinate for FIV. Plus, I think the vaccine itself had problems.
Vaccine itself, yeah.
But the problem was when we first... So I'm old enough to remember the FIV vaccine.
I am not.
I know. I always love these age moments and I get to tell on myself because I feel like I probably sound very youthful on the podcast, but
you're not old.
I'm 43. There you go, in case you're wondering. So anyway, So the deal is, like, I was a technician and we were vaccinating there for just like a couple of years when I was teching before vet school. And at the time, FIV cats that were diagnosed positive, a lot of times were euthanized immediately because we were concerned about potentiating the transmission, which a lot has changed with that. But at the time, all these cats then who were vaccinated were being tested and they were all coming up positive, and we could not tell the difference anymore between a cat who was vaccinated or a cat that had disease. So that's the fun fact about antibodies, because you can have antibodies to a disease and not have the disease.
Mhm. And that's where the kitten gets is because it basically has like a vaccine from its mom's milk. And then you have to wait for those mother antibodies to get out of our system to know if we are truly positive or not. And so a retesting will occur if that's the case. And then when we do have a positive cat, the kind of the risk factors that we're concerned about for them is their immunity. So essentially, a simple cold might be much rougher on an FIV positive cat than a non FIV positive cat. With like keeping that in mind, the big kind of concern there would be those particular cats need to be very well controlled with their annual vaccination. So the first question everybody always has, well, they're FIV positive, so we shouldn't vaccinate. No, the opposite. They
Right.
need their vaccines because we are really worried about their immune
And their
system.
dewormer and their flea and tick prevention,
And
because they're so much more susceptible.
yes, 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 yes. And then essentially, monitoring lab work would always be a good idea with those kiddos
Well, and
yearly.
their teeth are another big deal. We have a much higher incident of stomatitis where their gums get inflamed. And basically, the immune system's kind of like attacking around the bed of the tooth.
Mhm,
And then cystitis too, which is inflammation in the bladder, which cats like. I feel like all diseases in dogs go back to the GI tract, and in cats they all go to the bladder.
mhm.
So if you have a bladder problem in a cat, be aware.
Yeah, and you had brought up that back in the day, we would euthanize you would
Yeah.
back then, it would be like an immediate euthanasia. What about now?
So yeah, so now when we used to say, or if you didn't euthanize them, you need to be a single cat household, et cetera, et cetera. But because we are quite confident in there not being transmission of disease in cats that are not fighting or sexually active. So if you got a spayed or neuter cat that's inside and gets along with its housemates, this risk of transmitting disease is very, very low, and they live really good lifespans. They just are, like you said, more susceptible to diseases. So we have to be cautious and treat it. You don't just let them ride it out when they get a cold. You need them on a probiotic, may need upper respiratory antibiotic, something like that. But they tend to live full
Yeah.
lives.
Usually tell people this is yeah, they tend to live full, pretty normal lives when they're FIV positive. A lot of times when we have one test positive, we get the whole household in, and a lot of them are positive.
Yeah, that's true too.
And so there's always the discussion too of like where we go from here. I usually tell people to mitigate risk, separation is what would be recommended if you wanted to absolutely zero
Ensure.
risk,
Yeah.
ensure that there's no transmission. And that is what they say to do is to separate and have your FIV colony and then your normal colony, negative colony. A lot of people don't separate. So I think that's definitely where you're coming from is you see
It,
most families
yeah.
don't separate them out because they've already been together for so many years.
Yeah. That it just kind of, the ship sailed. It is what it is sort of situation.
Yeah, and so most people, I feel like, do end up understanding the risk, and
Yeah.
they keep them together. What I do, though, if they do choose to do that, because I ask them to tell me if they're doing that or not, I will flag their whole household as a high-risk
Potential.
household,
Yeah.
and so instead even though they're all indoors because if you're FIV or FELV positive, we recommend that they're indoor only, so they're
Absolutely.
not running to the neighbor cat and fighting and causing
Right,
issues.
and similarly, I wouldn't bring new cats in the environment because you're likely to disturb the peace, and
Yes.
then we're gonna have increased transmission risk again.
Exactly. And so if they do, I give them all the information and I'm like, this is what's recommended is to, have your separate kitties. But if they decide to keep them together, then they're flagged as high risk. And we test every cat every year to see if any of them come up positive,
Mhm.
which I haven't seen, but that's very non-empirical.
You have to, yeah, you really have to you have to really stay on that particular household for several years to get your own kind of like N of what
What's
data, yeah.
happening? Yeah.
Yeah, so but anyway, I mean, I definitely my panic threshold is far, 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 far higher for FIV. Like, it takes way more for me to be concerned than feline leukemia. They
Feeling
they
leukemia
tend to
is
do well.
more of a concern for sure. But
It
yeah,
is terrifying. Yeah.
FIV is not as immediate, I would say,
Yeah.
for a lot of things.
Yeah, the biggest thing is, the most common cat that I find that I'm diagnosing with FIV is some tomcat that lives outside. Great. Well, okay. So now he's getting neutered and he's staying inside.
Yeah.
So, and then also when I have a cat, let's say I have a cat that's indoor outdoor and it comes in and it has a cat bite abscess on its hock. I tell the owners in a month, let's come back, let's check for a FeLV FIV to see if the cat contracted it in that fight. What is your time frame? When do you do them?
I I think 3 months is I feel like I have been doing
That they can
30
come up
days, but
positive
3 months
as
it can
late
be as
as the
late
next.
as 3 months.
Yeah. So, I mean, if nothing else, you're doing it again the next year. But
Yeah.
yeah, you definitely aren't. If they're already FIV positive, it'll come up FIV positive. But if they contracted FIV from that cat bite, it
It
will
won't
not.
not be the same day.
Yeah. And you will not see it
And
yet. So,
usually I've lucked out and I'll be treating the cat bite abscess and be like, "So, we're negative." Because sometimes they'll let me test them that day and I'll be like, "They're negative today, but your wellness is in,
yes.
3 months." And so I'll
Hmm.
be like, "Just come and do your high
Yeah.
risk
Or
wellness
the cat's
assessments."
never been to a vet before in its life. And you go, okay, great. Well, then when we're feeling better, let's come back in 3 months
And
and
if
do our
he's doing
vaccines
this
test.
every 6 months,
Yes.
maybe we should keep him inside.
I mean, that's the thing, yeah. Even if they're neutered, some cats are just fighters.
Mhm.
So, okay, so that's kind of FIV in a nutshell. There, we test for it. We don't have a vaccine for it. There is no cure for it. We can help support the immune system. Probiotics are great. I love Fortiflora for that, just to keep the immune system as tip top as we can. And then any signs of any disease process needs to be treated aggressively, quickly, urgently, as opposed to the let's wait and see if he gets over it
Mm.
plan, because that they are such a higher risk for immunosuppression.
And then this is just a blanket lab work. Anytime any patient has any type of condition, routine lab work is a good idea because when they get older and their CBCs start to look different, which is their white blood cell, red blood cell counts and things like that, it's good to have a baseline to go off of.
Absolutely, yeah, and
Um,
and we're checking for, white blood count, which
yes.
can absolutely be impacted by this, and
Anything for
uh,
immunodeficiency viruses. So,
yep,
right. And
okay,
then not the even more not fun one.
the bad mammer jammer.
Yeah.
Ugh, I hate feline leukemia. It's the worst.
Hmm.
So this is also a virus. It's a retrovirus. It does also cause immunosuppression for sure,
Hmm.
but it does so many other really awful
Awful
things.
things.
Yeah, one of its claims to fame is anemia. So once they hit active disease, they will become wildly anemic because the cat's bone marrow, so essentially leukemia, right, in general, whether it's feline viral leukemia or just like plain old leukemia, is where we have cancerous cells, really, in the bone marrow that are producing ineffective cells at a high volume, usually lymphocytes, right, which is a type of white blood cell. It will create these lymphocytes in very high volume. They are very bad at their job because they're like a copy of a copy of a copy, and nobody gave them the instruction manual. They did not go through boot camp. They just got kicked out into the body immediately or into the bloodstream with zero functionality. And while the bone marrow is so busy doing that, it kind of like forgets and or doesn't have the resources or time to make all of the other cells like, red blood cells or neutrophils. And so the body becomes overwhelmed by this high population of lymphocytes and not enough functional
Hmm.
cells, which makes them immunosuppressed. It makes them weak. They're anemic. They stop eating. They just waste away. Is very bad.
Hmm.
Very bad. And then the other really fun thing that we see, sarcastically fun thing we see with feline leukemia is actually lymphoma,
Hmm.
which can happen in very young cats.
Hmm. And it's yeah, that's awful.
It is awful because there is not anything you can do. There's no treatment. Most cats, sadly, that contract feline leukemia as youngsters will not see their second birthday.
Hmm.
They either become too anemic or develop juvenile lymphoma, and it's just not compatible with life. And they just You can try antivirals. You can try managing
The new kind of therapy is the interferon.
the
Yeah.
interferon alpha. Yeah.
Yeah.
You can also, just manage all the secondary things that are going on, appetite stimulants, things of this nature, but ultimately only a very small number of cats will become what we call carriers and reach carrier status where they have the virus, but it's a retrovirus, so it's kind of hiding out in the background and not causing any actual problems. And it may stay there for, 5, 6, 7 years. And I have had a couple of those cats, but they are
Few and far between.
few and far
And
between.
it is when we do diagnose it in a younger cat, it's very much the conversation of, hey, like this is a ticking time bomb. One, two, transmission can even occur through like grooming, so
Yes, saliva. Yeah.
risk to the
Whole
whole
stuff.
household.
Hmm.
Kind of much easier to transmit in a household population than FIV than we kind
Well,
of
yeah. I
described.
mean, just like the difference between HIV and
Yeah,
like, I don't know, the flu,
yeah.
something like that.
It's just the transmission is just more likely to occur in the household habits, but so it's concerning. And it is a ticking time bomb. It's just like we know that this is likely going to rear its head and be nasty. We just don't know when and how bad it's going to look. And isolation, if they don't choose to euthanize, isolation is going to be even more
It's
pushed. Yeah,
imperative
yeah.
because it is fatal. Like it will be fatal. And the other thing that we harp on a lot here is testing prior to vaccination. Okay. So feline leukemia has a vaccination.
Hmm.
All cats should get it, and especially kittens. But if a cat has feline leukemia that is subclinical, like it's in its retroactive state, so it's just like chilling out in the system, not causing any problems, and you vaccinate them for leukemia, you can throw them into active disease and basically they will, die quickly. So I will not vaccinate a cat for leukemia without a negative test on file for that reason. It's just too risky for me. It terrifies me. So, what are your thoughts on that?
I think that's right. I mean, it's a very risky disease,
It is
and it's
aggressive. Yeah.
aggressive, and yeah.
And the
My
kittens,
I
absolutely, kittens can get it like from the mother in utero. Unlike
Mhm.
FIV, if we get a positive test, it could be false positive, but it's far less common.
Yeah,
So we still will, if we have a positive feline leukemia kitten, we will still wait and retest them again in 12 weeks.
and I've been doing the PCR with it
Yep, yep,
too.
yep, yep.
I've been
Yeah.
sending out a PCR with it and
You
just
can
do
do the
some further.
IFAs, the immunofluorescent antibodies.
Yeah, I've been doing some further testing just to because a SNAP test is great, but when it is positive, since all these situations are life and death, we
Need to
always
confirm.
confirm
Yeah.
before we make any decisions and discussions. But it is just wild the variability of the viruses too, because you do see older cats who have been positive for FELV for years, and the owner has kept them and they've done okay. And then you
Yeah.
have other ones that are too, and they're crashing out.
Yeah.
Um,
Which is by far the most common
yeah,
scenario.
yeah,
But if they have the ability to keep them isolated, then yeah, just keep going as long as the cat's little body is allowing you
yeah,
to. So,
yeah,
and then as far as, just routine management of the non-positive population of cats, we recommend if they're getting exposed to any other cats, whether it's because you brought a new cat into the house or they go inside outside or, any kind of other exposure, we recommend checking every year for feline leukemia. Otherwise, it's still probably a good idea to do every 3 years.
mhm,
And we vaccinate for it
yeah.
every 3 years, even if they're low risk.
And even when people are like, well, they go outside, but we wash them and then they come back inside in about 20 minutes and we're out there with them. I'm usually like, you should still do high risk because, which is what we call our wellnesses with the FIV, FELV testing. Because one day a car is going to backfire out the muffler and that cat's going to run.
Yeah.
And you want them to have the FELV vaccine. We want to know their status so that the following year, if
It's a
they're
pretty
positive.
small investment for
Yeah,
such a huge risk
yeah,
protection because the
exactly.
vaccine is quite effective. So
Yeah, yeah.
definitely, definitely worth it in my
And
opinion.
the best prevention, I mean, we have the FeLV vaccine, we don't have the FIV vaccine, but the best prevention is isolation. So it's
Yeah, which I mean, like, I'm not gonna hate on people having outside cats for sure. Like, I get it. It's just a totally different situation we're dealing with them. It's a different environment, different set of risk factors, different lifestyle, and that's okay. But you just have to be willing to accept those additional risks.
yep.
So,
Um,
which is all about life, right? Like, some people love skydiving. Like, they're absolutely accepting a different risk level
I'm
than I
not a
am.
I'm not a risk taker.
Same.
I'm just not.
Which is why we're probably both in medicine. We're
Yeah.
like, just,
Not a risk taker. I need
no.
to know every detail, and then I will still not be taking the risk, which is why anytime I get one of these as a positives, I'm always like, "Okay, like, it's recommended to isolate this cat from your other cats," and I usually am like, "Get all of your other cats in. I need them all tested
Yeah.
immediately. Do you wanna come in today?"
Yeah. It's an emergency.
It's an emergency because now I have this information, I need to close the loop.
Yeah. I mean, yeah, that's a fair position to hold, I
Yeah.
think, especially because it all boils back down to us being responsible
Yeah.
for this information, which is why we sit here today trying to share the information with as many people as will listen to us.
So vaccinate your pets, know the risk factors, mitigate risk. I
Yes.
sound like an insurance person.
Yeah. We should get you like some kind of Excel document to
Risk
calculate.
mitigation.
Yes. Oh my gosh. Speaking of though, this is a great plug opportunity to remind people that pet insurance is absolutely imperative. I was talking to this lady today on the phone because her dog had had a surgery and ended up being like a mast cell tumor. So it's like good we removed it, but the dog's not going to die from it.
Yeah,
Best case scenario, right? And she's like, "Yeah, I went ahead and got her pet insurance. I feel so bougie now." And I said, "No, this is standard of
it's
care
standard
now."
now.
Because, like, literally, if your dog has or your cat has an urgent situation, you have to go to an emergency hospital for a surgery. You could be out 8 to 10 grand before you can blink.
Mm, mhm. And
And
we
so
we can't be open all hours
we
of the day,
can't, we
and you have
can't.
sometimes have to go to an ER, and we apologize.
It's
But
just like my pediatrician, man.
another good example
Yeah.
is a very, very good childhood friend brought her cat to me, and we removed a tumor off of it. It was also a mast cell tumor, but cat mast cell
Cat mouth tumors
tumors
are not the
are a
same.
whole other
Different
ballgame.
conversation. Mhm.
And I looked at her and I was like, "Listen, we did not get it all because it was on the face,
Mhm.
and it was just relatively impossible to remove it all." I was like, "They are recommending radiation." And she said, "Well, that's okay. I have insurance." And I said,
There you go.
"Oh my goodness, well, keep me posted on what they cover and everything." And so obviously, we don't have a particular company we care about. We just look at the plan and figure it out.
Yeah.
But she went to Texas A&M, got radiation on her little cat
That's
face,
outstanding.
and the cancer is gone. I mean, and from that area, it's gone. We had
That's
another
outstanding.
recurrence, but it was in a different spot where we were able to fully remove it, so we didn't have to
Do the
go to
radiation
radiation
scene.
again. But I think she ended up paying like a fraction.
Yeah, your deductible plus a little bit of
Yeah,
copay or
I
something,
mean, but
which,
barely.
yeah, there's so many pet insurances out there. For the most part, veterinarians do not have anything to do with your insurance. So, like, let's just say you have a pet and it eats a tennis ball and has to go to surgery, and you go to whatever vet that you go to. They are going to tell you, okay, we got to take Fluffy to surgery and it's going to be this many dollars. And then they're going to give you an invoice and you are going to submit that invoice to your insurance company and they will pay you back all but your portion, which is usually like the deductible and your
Yes.
copay. And so it is a little bit different
You
in
have
that
to
sense.
front it,
You do have to
and then you
front
get
it.
reimbursed.
So be wary of that. And sometimes you don't have to pay it all up front. I don't know.
You have
It's
to know your plan.
yeah, yeah.
Yeah.
Yeah. So just check your plan. And some of them are
Wellness minded, some of them
yeah.
are emergency minded.
Some of the companies have breed exclusions. Don't love that. Look out for those because like they basically what they're doing right is removing the most likely thing that your dog is going to have. Like so if it's a boxer and they're like, "Well, we don't cover cruciate tears." You're like, "Well, that's
If it's
not
a
fair."
dachshund, they're not gonna do that
Dewbacks,
surgery.
yeah, but that's the most likely reason you will need it. So try to avoid breed exclusions. Most companies have realized they're not going to get away with that anymore. The game changing I have seen in insurance in the past like 7 years has been profound. It
Yeah.
is so much better than it was. So yeah, check it out. There's a bunch of them. We are not insurance salespeople,
No.
but we do highly recommend it because we have seen it literally save lives.
Yeah. And then another big takeaway too is just with the oh goodness gracious. If you have a pre-existing condition, they will not cover things.
Oh, yeah.
So know that.
Yeah,
So that
so
if
get
we
it
diagnose the dog with a heart condition
and then you
and
go
then
get
you go get
insurance.
insurance, that's not gonna work.
Nope. So
Uh,
get in on your puppies and kittens. If you already have a dog with a pre-existing condition or cat with a pre-existing
yeah,
condition,
sorry.
get it anyway because it'll cover everything else. And cat insurance is like really cheap.
Really?
Yeah. Like, I mean, granted, it's been probably a couple of years since I looked at it, but when I was looking at it for my cat, it was like $14 a month or something
Whoa.
for Pets Best. I don't know.
And there's a website called Policy,
Policy
P-A-W
Advisor.
oh, Policy Advisor, but
Yeah.
P-A-W,
Yeah, like a paw, like a
Policy.
dog paw.
And that compares and contrasts insurance companies.
It's like Travelocity, but for pet insurance.
Yes.
Policyadvisor.com. And yeah, there's just definitely some people's work will cover it.
Mhm.
I've seen more of that happening where people's, employers have pet insurance, which is just wild. Never did I think I would see that day happen. Here we are. Here we are. Okay,
What's your
cool.
pearls or takeaways
No,
from
that was it. So the takeaway from today, FELV is definitely the more significant disease overall. It is terrifying and should be prevented at all costs. FIV is not automatic reason for euthanasia or isolation as we once believed it was. Interpret any test results in clinical context and send out additional testing, of course, if needed. And then prevention is always the best medicine. Prevent through testing, vaccination, and exposure reduction. This is essential.
Woo!
Woo, you covered it. Like my take home message is you nailed those.
Yeah.
Yeah. Okay, so last little quick thing, just for expectation purposes. We are, like I said, struggling to get to our podcast time because we busy folk. So be patient with us. I don't, we'll just, when we get around to it and we
My
have a
eyes twitching
topic,
right now.
listen, if that dog test that we had for rabies comes back positive, we'll be back next week. But otherwise, it might be a month or two or whatever. Just like if you,
Please. I do not want to be back next week.
he's like, yeah, there's so many reasons why I need that to not be the case.
There's my eyes twitching. Nervously cleaning my chest now.
Rabies, vaccinate everyone for rabies. It's real. Okay. All right. We'll miss you guys in the meantime. I know you'll miss us too. I'm sure of it. I'm absolutely sure of it. Otherwise, y'all have a good one. Until then, bye bye.